in relation to universal health care. As I recall, this was mentioned during the start of his term. I would want to know if there are any concrete steps that's been enacted towards universal health care for all. In my experience here in Canada, it's really very simple, very easy to do. And in a country such as the Philippines, I would think that it's really doable. So I'm very curious to know if there have been any progress towards this. I'm curious to know how the president would go about any plans for universal healthcare. I mean, will he be expanding PhilHealth's coverage? Will he include outpatient care or primary care services to PhilHealth, or increase the budget for the Department of Health? As I am pretty sure that percentage-wise, the budget for healthcare in the Philippines is one of the lowest. So I'm curious if during his SONA, he will address or put more funds towards healthcare. I guess that's what I'm saying. Will he also be addressing related issues regarding healthcare? For example, the loss of manpower to other countries. Because if he wants to expand or provide universal healthcare, one of the key ways to do that is to provide more people. But if we are losing people because of financial or some other reasons, then that's also one concern. So I believe that we have a surplus of healthcare practitioners, doctors, nurses, that can be utilized if we can convince them to stay in the country. I also believe that funding for both the Department of Health should be increased. Hospitals, which are, I think, run down, can be upgraded, not just in the city centers, but also in other key areas in the country, especially the provinces. And I also believe that PhilHealth or something similar like Medicare, if Medicare is something we have here in Canada, where universal healthcare is provided for all, not just for patients who visit the hospitals, but patients who visit any medical professional, it's covered for free. Even so, if you go to the clinic, if you go to have your labs done, it's free. So I think we have that in place, and it's just a matter of doing the logistics, how to go about that. So I'm really curious if there's been any movement towards that.